What is the standard care for vasectomy reversal? Hi, this is Dr. David Wilson. I'm with the reversalclinic.com. We are the largest provider of vasectomy reversal in the United States because we are helping families grow. You may be on a search for information about vasectomy reversal. You may be trying to sort out the different, sometimes conflicting information on websites and chat forums and groups. You may hear some information on this video that you won't hear anywhere else. I'd like to share with you the results of the most recent U.S. survey that shows the customary standard care that is being done in the country. This study was performed by Dr. Crane and his group in San Diego and is reported as the practice patterns in vasectomy reversal surgery in the Journal of Urology in 2004. This survey study sent out over 1,500 forms to the U.S. Physicians, and of these 1,500, there were over 600 surveys completed, and of those surveys, 367 were finished by vasectomy reversal physicians, doctors who are actually doing the procedures. So we have a really good representation of the standard practice pattern in the United States. It's almost 400 physicians answering the survey. Of these 367 physicians, there were 223, or over 60%, that used a surgical microscope. So over 60% of physicians were doing a microsurgery repair of the vasectomy site. They were using the healthy ends on either side of the injured portion of the vas and bringing those two healthy ends together with the use of microsutures to perform this simple vas reconnect, this vasovasostomy. Now, there were 65 of the 367, about 18%, who in addition to doing the simple repair would also do a more complicated repair for a presumed second blockage. Now, they could not diagnose the second blockage before surgery. They would usually use the fluid findings during the procedure to indicate to them whether they thought there was a second blockage that was present. And 18% of the physicians in the U.S. survey, the most recent U.S. survey, were performing the more complicated repair for a presumed second blockage. Now, the physicians surveyed were in three groups. The first group identified themselves as infertility trained physicians, the andrologists. The second group were academic urologists. The third group were the community physicians. The 29 of the andrologists had completed the surveys, and of these 29, there were only 10 of the 29 andrologists who were actually performing the VE. So the vast majority of physicians in this study, over 80%, were doing a simple repair of the vasectomy site alone for the vasectomy reversal surgery. Now, it's interesting to see that 260 of these 367 physicians, about 71%, would give test orders to their patients, and the actual success of the surgery they would deem based upon those test findings. About 30% of the physicians were indicating success based upon whether or not the couple became pregnant or had a birth. So there were two groups. One group, the vast majority, based their success on test results, and the other group based their success of the procedure based upon the clinical outcome of pregnancy. Now, there's a third group today that are now defining success as a combination of pregnancy and test results. They're in the minority. What happens when you combine the pregnancy and test results categories together is that the success rate gets inflated. So we could say the customary practice in this country is to base the success of the surgery on positive test results. We believe that's the honest, reliable way. Now, we want to see the pregnancies, we want to see the child. That's the goal for the procedure. But to find out the outcome of the actual surgery, test results is the first step. And that's the customary way of gauging success in this country. Now, the number of cases per year was reported to be 10 by the physicians surveyed. There was a range. The andrologists or infertility trained subspecialists were completing on average 27 cases per year. The community physicians were doing 7 cases before. The average community physician did 7 of the reversals in 1 year. A couple of post-operative care notes I'd like to share with you from the survey. One was post-operative abstinence. The physician would tell the patients to refrain from activity on average for 3 weeks. And also the time to testing was 3 months. The test orders given by the majority of the physicians were to be completed at 3 months. That's because the motility or movement of the sperm keeps improving for the first few months after surgery. And so there's a delay in test time to get the most accurate result. That delay in testing at 3 months has nothing to do with resuming relations or conception. It's just the best time to test was at 3 months. So what can we say about the customary care? What's the care being given to the populace in America? Well, it's a microsurgical reversal. It's a use of a surgical microscope. And we could say that the vast majority of physicians are doing a repair only of the vasectomy site. The vast majority are not presuming a second blockage based upon fluid findings. They're preserving the epididymal function by not bypassing that, and they're doing a simple reconnect. And they are also telling their patients whether the procedure worked or not based upon test results. Now that's the approach the Reversal Clinic has taken. And we're very, very thankful for the many, many patients who've placed their trust in us. We've done the largest reversal experience over the past 12 years, to date over 6,500 cases. We do a microsurgical repair of the vasectomy site, a vasovasostomy only, for the first-time reversal patients under local anesthetic here in the clinic. We feel very good that we're providing our patients excellent care. You'll have to make your decision based upon what you see, what you've heard, but we think this is good evidence that this is the customary care in this country. Thanks again for watching. This is Dr. David Wilson with ReversalClinic.com, and we'll see you on the next video.